So we've got part 2 of our fire and ice peel here. The resurfacing mask has been on our patient's skin for, I believe, about 7 or 8 minutes, something like that. And Joe's just starting to take it off. And I don't know whether you can see if I try and close in, but the skin is looking slightly pink. And from my understanding, it feels a little bit tingly. Is that right, Stacey?
It is starting to tingle now.
Yeah. This is what they refer to as the fire part, and Joe's just going to remove this. So I'm going to hand you over to Jo, and she can explain now what she's doing.
So now what I'm doing is I'm actually using the cleansing complex again, which is now breaking down the mask, and this actually should start taking the heat out. Where Stacey's still red around this chin area here, you can see that where I've used the cleansing complex that it's starting to break down the redness. So I'm going to get a good amount of that on, which will start to take away the discomfort or the heat feeling that Stacey's feeling. I think discomfort's the wrong word perhaps to use. And plus this just actually enables me to remove it a little bit easier as well.
And how often would people have these, Jo?
Most people will try and get one in about once every 4 to 6 weeks. I mean, Stacey's, really stuck by coming to me. I mean, I think you had one 4 weeks ago we were talking, weren't we, Stacey?
Yeah, 4 weeks ago.
And we've really found that it's helped with any breakouts, enlarged pores. It's all worked out really well for Stacey. And she also continues to look after her skin at home with the IS clinical range to use at home, like the active serum,
right,
vitamin C, etc. So again, those really actually help boost the treatment that we've done today for her as well. So
you're saying it's about consistency, really.
Absolutely.
With it's perhaps not a one-off treatment. Unless it's just for a feel-good factor. If you've got a problem with your skin, you should really have a course. Is that what you're saying?
Well, I think they work better in a course anyway. You're going to see where your skin feels tighter, enlarged pores, etc. It's a good way to see whether you like the treatment or not, but it's not really effective enough to be dealing with enlarged pores, tightening, fine lines and everything. A course with what works better. And Stacey has really stuck to this course and been having them every 4 to 6 weeks.
I now have started having compliments on my skin as well, so they definitely do work.
That's lovely to hear.
So we're nearly there now. What I actually do now, just to actually help assist this, is that I've had a facial mitt in some nice cold water, and I'm going to use that, and that's just going to remove any traces, but it also helps cool Stacey's skin down. And you can see from the redness that you saw earlier now, this has actually now started to go down. Does that feel a little bit more comfortable?
Yeah,
now,
that feels fine, Jo.
There we go. So we've got some redness there, but nothing that we would actually worry about. And we also now know that using the rejuvenating mask, so this is going to put the hydration back into Stacey's skin. It actually smells really, really lovely. It's got that really nice, soothing smell to it. The only thing that's perhaps a little bit off-putting is that it's blue. But it does smell very, very soothing, very medical, comforting smell.
And is this the ice part?
So this is what they refer to the ice part, but this is where it's really important, because obviously if we just concentrated on resurfacing and then sending Stacey out of the clinic, then what she would actually find is that her skin would feel tight. She still may have that heat sensation, and this is actually what's going to stop any downtime. So this is what's going to stop the flaky skin, which sometimes a resurfacing mask years ago would cause. So I'm getting that over, and I don't know if you can pick up the colour there. We've got a slight blue.
Smurf-like.
Smurf-like. And how does that feel, Stacey, now? Does that feel like it's cooling it down?
It cools the skin down immediately as soon as it's on. Very soothing.
So we get all that over. And what I actually like to do on this is just actually lift the iPad, it's like there, and I like to go right underneath the eye with this because it's very hydrating, and not that Stacey's got any, but any fine lines, etc., this really will help out, you know, iron those out again, you know, which is why it's actually nice if you've got a wedding, special occasion, or just simply want to actually look at your best. Like most women will complain about their neck, so what I actually do with this treatment is I get this nice hydrating mask onto the neck area. And in a lot of the regimes that we do, most women will turn around and say, oh, I forgot about my neck. So this is like a really kind of nice added little boost to the treatment.
And how long do you leave this part on for, Jo?
Again, so what I'm going to actually do is I'm going to leave this on for another 7 minutes with Stacey, because, you know, Stacey is an experienced IS clinical user, so her skin actually will tolerate the resurfacing side, but I also now want to really get her some nice hydration into this and get it nicely cooled down for her. So we've got some nice hydration there going from the neck upwards. You still see it's blue. If you probably look towards the forehead, you can probably see that the redness is starting to come down a little bit with that, and it'll start to work its way around. So I now will set my timer and be underway with that. So I'll just do that so I can get that going. When I've actually come now to remove the mask, because there's actually not much more to watch with this actual process here, there's a couple of products that we actually then like to add to, again, to keep this mask working and actually help soothe the skin and also send Stacey on her way, you know, with some good protection. So again, we're going for the IS Clinical Super Serum, and this is a vitamin C product, and I will literally take a few drops of that and apply some to the forehead, some to the cheeks, some to the chin, and just then taper it off around the neck area. After about 30 seconds, I will then actually apply the Hydra Cool Serum, and this works a little bit like the hydrating mask. It's a very, very nice feeling, and then if I just actually pop a bit on the back of my hand so you can see. So again, we've got that nice blue colour, and you can see how simply that is gliding, and probably from my one hand to the other, see actually how hydrating and moisturising that is, and that will actually lock in to Stacey's skin, and that actually will bind water. It's got the added advantage of having a vitamin B in there. And then just to finish it off, because we've obviously been resurfacing the skin, we know an important part of our regime then is actually to pop an SPF onto the skin, and then we'll allow Stacey to go home.
Lovely, thank you.
That's it.
Thank you very much.